I'm Dr. Yanni and I'm from the Urban Clinic, and today we'll share a little bit more about hair. I usually classify hair loss into 3 different categories. The first category is genetic hormonal hair loss. It can happen in men and women, but the common thread is that it happens in other family members. The second category is inflammatory hair loss. Usually patients complain of itchy scalp, sensitive scalp or flaky scalp. The hair loss with this kind of inflammatory conditions tend to be quite sudden, and it can result in a bald patch over a very short period of time. The third category is reactional, stress-related or nutritional hair loss. Now this category can happen in any age group at any point of time, as usually the main presentation will be heavy shedding of hair, and we do see it very frequently in clinic. Hair loss in women is very common. Almost every woman will have experienced hair loss at one time or the other. It's whether it bothers you enough. For example, when a lady has had a baby and the baby is about 3-4 months old, it's very common to experience heavy hair loss. The other time that women will experience hair loss is when they go through menopause. As we enter menopause, our hormonal profile changes a little bit, and this can accelerate or make hair loss faster. The other thing that happens as we age is that we tend to eat a little bit lesser, and we especially take too little protein. So I always tell patients you should try to take 3 fist size of proteins a day, 3 portions, that this amount, to replace the proteins that your body needs. Not many women do it. Women tend to eat food that are tasty like biscuits, bread, noodles, and they actually have very little proteins, very little vitamins, very little antioxidants. So many hair and skin supplements replace proteins. They also have higher percentage of vitamin Bs and antioxidants like vitamin E's to help replace what your body needs to regrow hair. In Miriqa, they also have natural extract called salpomator berries. It blocks the effect of DHT, which is the hormone that increases at menopause that causes hair loss if you are susceptible to DHT hair loss. So it is a suitable supplement for perimenopausal hair thinning. The most common hair loss that I see in clinic is stress-related hair loss. So stress-related hair loss can happen after a severe illness, a bereavement episode, you lose somebody that you care for, and definitely chasing deadlines at work. Things change, right? You don't eat very well, you tend to sleep too late, too little, and your body adjusts to this situation. So many patients present with hair loss 3 months to 6 months after the stressful period, and the hair loss can happen for another 3 to 6 months, which is very stressful, and patients will report losing up to 300 strands of hair a day, which is a lot. It's enough to choke out the toilet so they can see it. It's so common, what can we do about it? You can focus on encouraging the new hairs that will keep coming out to be as healthy. I always emphasize protein is very, very important for anti-aging. Protein is also very important when you lose hair, you need to regrow hair. If you're taking insufficient protein, then you can consider a hair supplement. The hair supplement should have some of these ingredients, including either collagen, keratin, vitamin B, some antioxidants if possible, and that would promote the new hair to come out well. When you go through a stressful period and experience hair loss thereafter, I would highly recommend considering taking a hair supplement for at least 3 months, if not longer. There is no magical hair loss shampoo to arrest hair loss. There is no magical serum that you can put on your scalp to encourage hair growth, mainly because the scalp is extremely thick and it's very, very difficult to penetrate useful ingredient into the scalp. And that's why we usually encourage good hair from what we take orally, including supplements. After giving birth, you are having this stressful period of life with poorer nutrition, and because of the dropping hormones, the hair would change phase. So it changed from a stable growth phase into a shedding phase. So about 3 to 4 months after you give birth, that's when the shedding starts. Now this shedding can be prolonged if your nutrition is not good and you're not getting enough rest. Diet is important, I keep emphasizing. But if you don't think you're getting enough, get a hair supplement. Start early, right after you have your baby. Many of the hair supplements that we have on market are actually safe for breastfeeding. Some of the things that they should have in a hair supplement should be either in the form of collagen or keratin, vitamin B, some antioxidants, usually in the form of vitamin E. Some have extracts to prevent hormonal hair loss, and some have cool new ingredients like copper tripeptide. So one of the supplements I do recommend for my mums is Miriqa. Not everybody who has gotten COVID will experience hair loss. Some might. If you had COVID about 2-3 months ago, and suddenly now you're going through massive shedding of hair, that means more than 100 strands a day, you could be going through a reactional hair loss. And my recommendation is, 1, try to get your body in tip-top form, right? So sleep early, make sure your diet is good and balanced with enough proteins, vitamins, antioxidants. Try to manage your stress well, and don't over-worry about the hair that's coming off. Focus on the fact that you want to keep the shedding period as short as possible and to encourage good regrowth of hair. Hair supplements will be something that I would start early if I went through a severe bout of COVID and I'm recovering from it. I love to share about my hair care regime because I'm extremely lazy. So after I enter my 30s, have had 2 kids, it bothered me more that my once luscious hair started to thin. So these are my advice. Number 1, physical, okay? So try not to tie your hair too tight. Some of the frontal balding is due to bad hair practices. Number 2, you try to reduce chemical processes on the hair. Number 3, maintain a good diet. Only in recent years, I introduced like a protein shake in the morning to up the amount of protein that I take in a day. Sleep early, so I go to bed by 11 and wake up by 6. Manage stress by doing a bit of exercise, learning to take deep breath, and I've introduced supplement. I was never a supplement person in my 20s. But in my 30s, I realized that actually certain supplements is necessary because what I cannot give my skin or my hair topically, I can actually take it orally. And Miriqa is one of the supplements that I take regularly. I take it 2 tablets every night. I know that the quality is good. They have a combination of ingredients that I like. One of it, of course, keratin, collagen, vitamin B, vitamin E. Also saw pomator, berry extract. So that's very unique for patients who might be suffering from some hormonal hair loss. So it's a good supplement to take because it's natural and doesn't cause any side effects. And copper tripeptide. So I have a love for copper tripeptide. It's a very rare ingredient and it's actually great for patients who have suffered burns. It helps the skin to regrow. Unfortunately, in hair, it's very difficult for such an ingredient to penetrate. So they have it orally, which is incredible. So I take Miriqa 2 tablets every night to encourage any hair loss to come back well and good.